Let's get right to it. Dr. Oz, thank you so much for joining us. As you know, Florida has such a high senior population. Open enrollment is here for Medicare. What do Floridians and Central Floridians need to know about this year's open enrollment?
Just an open enrollment is always an important time of the year. This is your program. It's a social safety net system. It's the crown jewel of our nation's ability to take care of its seniors. And open enrollment is the time when you need to go to Medicare.gov or call 1-800-Medicare if you don't like websites and just figure out if your plan is the right plan for you. There's lots of new plans out there. Your plan might have changed. You might be on new medications. You change doctors. You need new doctors. All these reasons are out there, and you can save hundreds, maybe even thousands of dollars if you go to the site and just figure out what's best for you. And remember, there's no salespeople, there's no pressure. We're not trying to get you to do anything. We're just informing you. So when that onslaught of Medicare Advantage ads hit your screens, you'll know a little bit more about where you are, so you'll be able to make a wiser choice.
Yeah, that is overwhelming each and every time with that onslaught of, the different options out there. It becomes overwhelming for somebody. What is the best advice? Is it to go to Medicare.gov or call the number that you just mentioned? How do they sift through that and pick the right plan for them?
Well, Justin, 1-800-Medicare is a super simple way of just talking to somebody. But what I tell people is go to Medicare.gov. If you want to, go there with your spouse or child or grandchild. Create your own account. That's a pro tip. If you create your own account, you're allowing us to help you because we know what medications you're on. We pay for them. We know your doctor. We pay his bill or her bill. So you can take that information and customize the kind of coverage you need. If you have a new healthcare issue and you want supplemental benefits that might target your ability to get exercise or get different foods as part of your plan, we can help you with all that. That way you can find a plan in your area that works. Now, Orlando's got a lot of plans and you got a lot of choices. Not all of them are equally good for you. Why would you pay hundreds of dollars extra for a medication that was fully covered on a different plan if you just known about it? And these supplemental benefits, they change year to year. Your plan may have changed since last year. So why throw away hundreds or thousands of dollars by not taking advantage of this wisdom?
Right. And that might be one of the mistakes, but I'm curious if there are any other mistakes that we see time and time again, each and every time there's open enrollment that somebody makes, and how can we avoid those mistakes?
Well, the biggest errors I see are people don't actually sign into the system. They just go to the website and look around a little bit, but without signing in, we can't customize the advice you're getting. The other rookie error is you don't do it by December 7th. That's a concern. If you don't make your decision by December 7th, it restricts your options quite a bit. And you could be throwing away a fair amount of money, but also you throw away flexibility. When you're going to take care of yourself, if you eat the right things and exercise and try to get sleep, those are all critically important. That's the foundation of your health. But so is having the peace of mind that you have a health insurance program that works for you. And you already have this. It's yours. You own it. I'm just asking you, as all of us are here at Medicare and Medicaid, just to go out there and take advantage of all the things we've built for you so you can make the wisest decisions.
Unfortunately, we see scammers trying to take advantage of this as well and prey on seniors during this time. How do we avoid those fraudulent offers that are out there?
If anyone calls you, they're lying.
Mm.
We don't ever call you without you calling us first. So you should be reaching out to the people trying to sell you programs. In our case, we're just trying to give you information. But again, we won't call you. Call us. That's one of the ways you'll know if it's a fraud. But also, you should be knowledgeable enough about the opportunities out there that if what the person is saying to you as they're trying to sell you something doesn't quite sound right, you can do better. We think there are a lot of great brokers out there who are trying to help you, but not all equally good. Some are unethical. Some just don't know the business very well. We're experts. We can give you guidance about what kind of plans will serve your needs and get you there by December the 7th, which is the deadline. But if you really want to de-risk this process for yourself, go to the government site, Medicare.gov, and take advantage of all the wisdom. We've got a bunch of really smart people, a team of experts who've upgraded the program, improved the experience. We're waiting for you.
A common question that we are being asked right now with the government shutdown continuing to loom, and obviously healthcare being a central component of that. So many people have wondered if this is still something that they can do with open enrollment. Obviously, the answer is yes. But can you eloquently put further detail on that everything is good to go and open enrollment's still good to go?
Justin, there's a few programs which Democrats and Republicans both hug and like and support. Medicare is an example of that.
Mm.
There's no debate here politically about the validity and importance of these programs. They're yours. We know they're yours. We want to protect it as a program because it is our crown jewel in the social safety net system. So there's no impact from the shutdown on Medicare. The program is healthy. It's funding everything, paying doctors and hospitals. You, as a beneficiary of the program, need to do your part, though, to go to Medicare.gov and sign up appropriately so you know where the opportunities are. I just turned 65 years of age, so I'm a Medicare beneficiary, proudly able to say that now.
Mhm.
So I'm in the system as well, and I know how much we've improved it, and we take great pride in what we've been able to build for the American people. We just want you to taste it. You'll like to cook it.
Vaccines, everything like that, also part of this as well. We have whooping cough going on here in the state of Florida. Obviously, cold and flu season is here as well. That's all good to go, right?
You know, you have coverage of all the vaccines and other benefits that are part of the federal program. We want people to stay healthy. And again, part of the MAHA movement, making you healthy again, is to ensure that you have preventive services available to you. Having health care is one of those preventive services. Plus, you get peace of mind that God forbid something were to happen that was bad, you've got health care coverage. There'll be people out there who are get paid to take care of you appropriately, so you'll get top tier care because you have health insurance.